Merhabalar, ben dikkat eksikliği hiperaktivite bozukluğunun otonom disfonksiyonu.
Hello, I will be speaking about the correlation between autonomic dysregulation and ADHD. This is the most commonly observed group in our clinic. Its prevalence is between 5 to 7%, and there are some core symptoms, like these are characteristic symptoms: inattention, impulsiveness, hyperactivity. We can count these three as the core symptoms. And of course, there are some negative consequences of those symptoms in the ADHD. In the recent times, it has been shown that emotional self-regulation has a correlation with those deficits. If you can detect the emotional self-regulation, then you might have an advantage for the treatment. There is a close connection between the emotional self-regulation and the autonomic nervous system. Indeed, all of those has been detected in the heart rates, and it has an important role, dysregulation in the ANS. Vagus nerve innervates the heart at the sinoatrial node. If we evaluate the studies for ANS and ADHD, there has been some theories that establish the basis and foundation, and one of the theories that stands out is the polyvagal theory, and polyvagal theory has been founded in 1995, and it is expressed with bidirectional method, and bidirectional communication between the heart and the brain is expressing the correlation between ANS and ADHD. According to that theory, there are two sources of the vagal efferents: the dorsal motor nucleus and the vagal nucleus. Originating from the dorsal vagal nucleus, vagus nerve is responsible for passive motor neurons, and the other one is important for the social interactions. The nerve group, which is important for social communication, is comprising myelinated fibers. It has behavioral function in social communication and also in certain inhibitions. Dorsal nucleus, on the other hand, is working slower, and it doesn't have myelinated fibers. It is responsible for immobilization and avoidance after trauma and for passive fright. Polyvagal theory is a hierarchic system in itself. If you are in a safe environment, parasympathetic nervous system and the sympathetic nervous system will be on balance, and you will establish the eye contact, and you will be easily socially interacting, and you will easily understand the stimulants surrounding you, and this will ease your facilitation to your environment. But if there is a negative stimulant, then the sympathetic nervous system will be activated, and the balance between those two systems will be impaired. In such cases, parasympathetic nervous system activation will also trigger fight or fright mechanism, and this person might either fight or flight with those stimulants. And if this mechanism is severe, then there will be higher regression. In the traumatic cases, it will be immobile, and the person will be dissociated, and he or she will have frozen effect. In the PTSD studies, this polyvagal theory has been appreciated as well. You can see the scheme here. Dorsal vagus is a much more primitive structure the ventral part is important for social communication. If the sympathetic nervous system is activated, then the fight or flight mechanism will be the responder. One of the most widely accepted theories in the ADHD, it is correlated with the motivation. That's why we have to take a look to the biological models in psychology of the gray. Those studies are evaluating motivational theory in terms of biology and psychology. This theory has been founded in 1970s and it was revised many times. It was used for the bipolar disorder for the first time. Behavioral inhibition and activation systems has been mentioned in theory, and these systems are changing according to the reward and punishment mechanisms. Reinforcements are also important in the motivational theory. Through reinforcements, the behaviors will be changing. If the inhibition system is active in a person, the clinical presence will be resulting in a neurotic structure, in introvertedness. If the behavioral activation is higher, then the impulsivity, extrovertedness, risk-taking, and adventurous type of behaviors will be much more common. With regards to gray motivational theory, there is a scale. Maybe it might strike your attention. Behavioral inhibition and the activation scale might be seen in this presentation. This scale has been translated into Turkish and it was validated. A group in Hacettepe was validated this scale for Turkish. Taking these two theories into consideration, there has been many studies in order to come up with the third theory. Integrated model will be the name of this third theory. With the stimulants of the CNS and ANS, sympathetic or the parasympathetic nervous system will be activated. If the parasympathetic nervous system is much more active, dysregulation will be the reality. If the sympathetic nervous system is active, the behavioral inhibition balance will be present and the emotions and the presentations will be observed. I would like to speak about the HRV because HRV is quite important in the ADHD studies. HRV is a natural adaptation mechanism in different environments and contexts. The HRV is something plus, something an advantage for the person. But for the ADHD kid, the HRV will be found to be much less. There are many claims that HRV cannot be a biomarker because it's a very simple method and we don't see biomarkers in the psychiatry. It is cost effective, it is affordable, it might be used, everybody can have an access on it. Holter or ECG type of monitorization might be used for the HRV. In 2015, there were some studies and data accumulated stating that the HRV might be a biomarker. A guideline was published after that. And in those studies, how the HRV will be calculated was also mentioned in the guideline. Emotional regulation And ANS in the ADHD is impaired, but the reflections of the emotional regulation will have an impact on the future life of the people, because the impairment in the emotional regulation will result in oppositional defiant disorder, personality disorder, and the antisocial personality disorder in the later ages. The correlation was shown in the studies. The treatment of the ADHD is something we do in our clinical practice daily basis, and there has been some studies about the HRV and its correlation with the ADHD, but the number of the studies are not enough. A couple of studies show that it has no effect. Some of the studies are asserting that it has a indeed insignificant effect. In the current studies, autonomic system regulation and the cognitive tasks will be compared. Autonomic system regulation is correlated with the cognitive behaviors. In the upcoming studies, in the review, it has been stated that there is a need for the effect of the medication on the ANS, because this is a question mark. We don't know. Thank you very much.